If you have endometriosis and you suffer from leg pain, you'll want to hear this. 10 years ago, I was diagnosed with a condition called meralgia paresthetica, which means trapped nerve in the groin. Now, I've had leg pain for about 14 years, and I'm pretty sure it's related to my endometriosis. Just iced my leg. Do you see the area on my outer thigh where you can't see any goosebumps or redness? The area is numb. I was only diagnosed with meralgia paresthetica after having several outbursts at my then GP, as I was experiencing immense pain, numbness, and burning sensations, which I typically experienced when standing or walking for prolonged periods of time. Step 1 of the investigation was the Lasègue test. The Lasègue test is meant to manually identify any nerve causes. So for the test, you lie down, legs extended, and the neurologist will lift each leg up until the point that you feel pain or any other symptoms. I didn't feel any pain, unsurprisingly, as my pain hadn't been triggered prior to testing. Step 2, I was sent for an MRI to assess my lumbar spine. Fortunately, it came back as unremarkable. For the third and final step of investigation, I was sent for an EMG, electromyography study. Now, this test was a little bizarre. I was basically poked in the thigh with very fine needles, like with acupuncture, and electrocuted. The needles are connected to a machine that sends electrical waves to measure muscular response to stimulation. The test found that my muscles were fine, concluding that I had meralgia paresthetica. I was diagnosed with the compression of the lateral femoral cutaneous nerve. It's the nerve that controls feelings and sensations in the surface of the outer thigh. This nerve is located in your pelvis. It passes through the groin down to your upper thigh. If the nerve is compressed, it can cause pain, numbness, and tingling across the front and side of your thigh. Now, what are the common causes of this condition, you ask? Pregnancy, obesity, tight clothing, injury to the area, or surgery. Now, aside from being a temporary fan of tight jeans, I did not qualify for any of those causes. Yet I was discharged with my diagnosis and one very generous physiotherapy appointment on the NHS. Thanks, guys. Surgery is, you guessed it, rarely advised because of the risk of nerve damage. Fortunately, these days, leg pain is known as a fairly common symptom of endometriosis, but not by all. In fact, just last week, when I mentioned my leg condition to an endometriosis specialist consultant, I was told, no, it's not possible that your condition is caused by endometriosis. Well, I conclude that it is, because there is no other rationale for why I've had it since being a menstruating teenager. As per my previous post on leg pain, endometriosis on or near nerves within the pelvic area have been connected to endo-based leg conditions. Do you experience the same or similar leg pain? Let me know in the comments.